director of He's the director of program strategy and management with Healthcare Without Harm. And then Shane's he's the head of sustainability management at Oakwell. And I'm going to let them talk a little bit more about themselves, diving deeper on their introductions. But with that, I'm going to pass it over. Oops, team. I'll stop my share and let you bring yours up. There you
Oh,
go.
great. Okay, I can share you want me to share my screen or was someone else planning to?
You can share yours, Jenny.
Okay, sounds good. All right, is everyone seeing the slides now?
Almost there. It looks like it's coming. There you are.
Okay, thanks for your patience there. Good to see you all. Really appreciate the chance to be with you here today. Um, as Sylvia mentioned, I'm Jenny Keroack. I work for Healthcare Without Harm, and we're a 30-year-old organization that works with hospitals, health centers, insurers, pharma companies, basically any health sector organization to help them reduce their environmental impact and make resilience improvements to protect the health of their workers and of their community. So Shane and I are going to talk today about a partnership that organizations have had to help healthcare organizations leverage the amazing opportunities that were created by Congress for all kinds of energy efficiency, renewable energy, and other sustainability improvements to healthcare facilities and other nonprofit organizations. First, I will just talk about kind of as a healthcare organization, why we see so many folks investing in sustainability. I think for a lot of people who are not in this space or who haven't worked in healthcare, it can seem like sustainability is something that you layer on top of a healthcare organization's mission. Like the mission is to give healthcare, and then like if you have time to recycle, that's great. But really, as I think a lot of you already know, sustainability goes way beyond recycling and is really core to a healthcare organization's mission, its ability to stay open during emergencies, and its ability to serve its community and act as an anchor for the folks that rely on it, both the staff and the patients. So I'll just give you a couple of examples of that. I don't want to belabor the point too much, but one is Chiricahua. So this is a health center, a community health center that's in rural Arizona. And they were subject to all kinds of power outages that would destroy their vaccines, destroy their products, make it so they couldn't serve their community. And so they put in solar with a microgrid to protect their patients and products from those outages and ultimately have better operational savings, better operational efficiency, and offer better care to their community. Another one that I want to talk about is Ohio Health. So this is a rural organization as well in Ohio, and they put in electric vehicle chargers where they would charge their fleet at night, but then during the day, anyone in the community can use those for free. So that includes patients, staff, as well as other community members. In a rural community where there isn't a lot of charging infrastructure, that is incredibly helpful and transformational for folks thinking about investing in electric vehicles or who already have one but can't always find a place to charge on the road. And then the last example that I'll talk about is Boston Medical Center. They have this amazing program called the Clean Power Prescription, where they're using the energy they generate to offer savings to their patients, totaling $600 a year to patients to help pay for their electric bills. And this started because a doctor was seeing that her patients couldn't run their AC in the summer and were suffering illnesses caused or exacerbated by heat because of that. And so this money that, comes from the power they're generating goes directly to the patients. And in all three examples that I just gave, Chiricahua, Ohio Health, and Boston Medical Center, the way that they were able to finance the project was in part because of the Inflation Reduction Act and the tax credits that are made available to nonprofits to do things like invest in solar, energy storage, and vehicle charging. There have been some changes to those credits, as I'm sure you may have heard in the reconciliation bill that passed on July 4th, and I'll talk about what those are. But I wanted to offer these examples of ways that healthcare providers like you all have found ways to protect their communities better through these investments and ultimately serve their core mission. So, a couple of other bright spots I wanted to just chat about with you before I jump into the changes to the bill. Healthcare Without Harm offers environmental excellence awards. We've been doing this for 11 years now, and so these are ways to recognize healthcare organizations that are doing amazing work in the field. One thing that we were really happy to see, especially in this year that's otherwise had some real setbacks, is that we've had record-breaking participation. We had almost 500 facilities participate, including 92 for the first time. We saw $200 million in savings from sustainability investments. And these can be things like recycling or solar panels, but they can also be things like switching to lower emissions anesthetic gases, lower emissions inhalers, other ways that, sustainability is really being built into the clinical care delivery system to both save money, improve care, and ultimately lower the environmental impact of that care on the community. And then we also saw a lot of energy conserved. So we're really happy to see the progress that's happening in this community of dedicated healthcare providers, again, despite some of the challenges that are happening in the political arena. To talk a little bit about the IRA impact specifically within that cohort, we saw an estimated $154 million in savings from hospitals in 2023 and 2024 due to those investments financed by the IRA. So things like the Boston Medical Center, Chiricahua, and Ohio Health examples that I mentioned earlier, these investments ultimately save money for the facilities, improve the care they provide, and make them more reliable for their own patients and for their community. And I think one way that you're really seeing that accelerate action is that this is happening across the entire country, not just in blue states that may have other incentives that layer on top. It's happening everywhere in part because this is really core to a healthcare organization's mission. If you're able to be more energy efficient and stay off the grid longer during a power outage, or if you're able to offer your patients financing to offset their energy costs, that helps reduce the spending of the healthcare organization ultimately and saves money because you're able to not to avoid losing products, avoid having care that can't be given due to a storm, and also to just support the community better and do better preventive medicine to avoid really costly things in the future, both for the patient and the facility. So that's something that we've been really happy to see. Something that is candidly a challenge is that there were major changes made to the IRA in the reconciliation bill. So I'll just talk a little bit about what those were. And I want everyone to, it's good to acknowledge that there has been ground lost here, but I also want to highlight that there are a lot of opportunities that are still available, and I hope you all will consider them because, as Shane will talk about, there are still amazing ways to use these federal dollars to save money and improve care and operations at your facilities. So, just to start from the top, there was a reconciliation bill passed in July, and this made a lot of changes to the credits that were originally passed in the Inflation Reduction Act, or IRA, as I've been calling it. Some good news is that direct pay, transferability, and a lot of the bonuses are unchanged. And direct pay is especially important for you all, I think, to be aware of. This is the mechanism where nonprofits like hospitals can access the credits via getting a direct payment from Treasury. So even though, hi, Phil, did you have something to say?
Nope,
Okay.
I'm sorry.
No, it's fine. Good to hear from you. Um, direct pay is a mechanism where even though you have no tax liability as a nonprofit hospital, for example, Treasury will give you a payment equal to the amount, usually about 30% of your investment, but it varies by the credit. But they will give you the direct payment based on the project that you complete. So even though you have no tax liability, you can still get the payment directly from Treasury. What did the IRA, how did it change in the reconciliation bill? I'll give you some of the biggest, I think, highlights for the health sector. So some things are expiring much sooner than they otherwise would. And that includes the credit for charging equipment for electric vehicles, as well as a deduction for energy efficiency improvements. Both of those expire next summer. So those are things where if you're planning to do a project that leverages those, it's really great to think about that soon because we want to get that started before the expiration date. For solar and wind projects, similarly, there's a shorter runway now than there used to be. They have to begin construction by July 4th, 2026, or be placed in service by the end of 2027. However, something I want to note for you all is that for other technologies that are zero emissions, like geothermal, hydropower, and nuclear, you'll have until the end of 2033. So there is a really good silver lining there around other types of zero emissions technology. And there'll be a couple of slides at the end of the presentation that go over each credit and when it expires. So don't feel like I know I'm running through this quickly. Don't feel like you have to remember all of this. I just wanted to give you some examples of the credits that are of greatest use to healthcare organizations. The last example I wanted to offer is energy storage projects and geothermal. So for energy storage, which are things like microgrids where you can store energy that you generate on site, including those from solar and wind, it'll be open until the end of 2033. So that is a great example of a credit that I think a lot of folks should consider pursuing. And then for geothermal heat pumps, you'll have until the end of 2032. So some good silver linings there. And I hope that helps folks feel a little bit better versed in the IRA and how it's changed, there are still a lot of opportunities to use these going forward. Okay, so that brings us to the cohort. So this cohort was begun by a group of organizations. You see our names on the screen here, with a focus on trying to help healthcare organizations and specifically hospitals leverage the credits that are available through the IRA to reduce their emissions, reduce their pollution, and ultimately improve care and improve community health. So it involves the Commonwealth Fund and Wells Fargo, which provided funding, Healthcare Without Harm and Practice Green Health, my organization. We helped hospital sustainability leadership figure out what made sense with their long-term plans. The Essential Hospital Institute also worked directly with their member hospitals to help them figure out what made sense for their core mission. And then Oakwell, you'll hear from Shane in a moment from Oakwell, really did the on-the-ground work to do the energy audits, develop the plans, and identify funding sources to make sure these projects could happen. So this was our cohort. It's the first time something like this has happened in the healthcare sector, a really innovative model focused on helping folks use all of this money that's on the table, thanks to this act of Congress, to accelerate healthcare innovation and sustainability across the sector. We had three hospitals, and I see some of you are here. I saw Phil a minute ago. So we had Jackson Health System in South Florida, Henry Ford Health in Detroit, Michigan, and Grady Health in Atlanta, Georgia. So these three pretty different facilities, but all of them with advanced sustainability teams that have done a lot of work in this space. We got together as a group to figure out how can we accelerate your work and how can we help you improve your facilities and save money using these credits. So these are the references I mentioned. I'll just show you what they look like, but they'll be at the end of the deck that you all receive. And now I will turn it over to Shane to talk about the cohort's work and all of the great things the Oakwell team led on. So I'll stop sharing, Shane, and hand it over to you.
Sure. Thanks, Jenny. Let me just get my slides up here. This picture there. Two. Well, can everyone see full screen?
Yes.
Excellent. So I'm Shane Dunne, the head of sustainability management here at Oakwell. Get through some really quick kind of about Oakwell to start off for frame of reference on who you're talking to here. Really excited to be with you guys. I'm thankful today and thankful for the Han hosts and everything that all you guys do through your amazing organizations and membership, being anchor institutions for your community. And like Jenny said too, I think we're going to sit in the silver lining space of what's going on today because there's just so much opportunity. There's so much opportunity out there for hospitals and health systems to really pursue these high ROI transformational efforts. So real quick, Oakwell was actually co-founded by Boston Medical Center as well as a firm out of Pittsburgh named Amicello, and we are an infrastructure and resource efficiency firm. So a one of a kind group of engineers, sustainability professionals, real estate expert, financiers that are really working collaboratively to deliver high ROI infrastructure projects and sustainability management programs for health systems in the US. We came from different organizations to formulate Oakwell to really be an accelerant in the space, and our vision is to save US health systems enough money that 1 million additional people will be able to receive access to quality care by 2035. So, what we do from this end, and Oakwell's model really creating cost savings, the savings that we've delivered for clients are in excess of 525, now $530 million through really this four-pillar approach. We're going to be talking about things today that drive energy efficiency, infrastructure improvements, framework efforts for sustainability, and optimizing real estate portfolios. That's foundational to what we look to do. Our four-pillar approach is seen on the left side. We find infrastructure or resource inefficiencies, either the built environment or the programmatic end, designing high ROI and high impact solutions through either or potentially through multiple of our project engineering, our real estate optimization, or our sustainability management arms. Then we have really high value proposition models to deliver turnkey solutions with our transparent project delivery is really an open book, transparent turnkey project approach that really delivers with potential shared savings models and just a completely open book, transparent approach to infrastructure builds to avoid cost overages, to avoid really going over budget and making sure that we're delivering and ensuring that the value remains and lies with the health systems. Also, it's very difficult to figure out how to pay for these types of efforts. So one thing that we also do is we help finance these projects. In and above the types of things we're going to be talking about today in evaluating financing sources for the projects we identified for these amazing cohort institutions, their facilities, we have other models that come through to help pay for projects that can deliver high ROI solutions. The power of the partnerships here. I'm gonna just kind of Jenny did an amazing job talking about the cohort structure. The hospitals that were really chosen to launch the cohort, Grady Memorial and Grady Health System, Jackson South within Jackson Health, and Henry Ford and their Wyandotte facility. It's been a pleasure to work with these organizations and the leaders there, as well as, the partners within the cohort. And special thanks, of course, to the funding that happened within this unique partnership. So the cohort model itself and what we looked to deliver from that end was really just, we always were rooted in the value delivery of this space. So the value proposition on essential hospitals joining the cohort, this was work to be acceleration of long-term energy efficiency, cost savings, decarbonization, and stakeholder engagement, as well as resiliency and all sorts of other benefits. And really, so many of these really high impact efforts can be foundational pillars for sustainability, for social and health equity type things. And we lead with that kind of high ROI and profitability because we've seen the successes that have happened actually through being able to spur very large programs through a lot of high impact pursuits and opportunities and wins. So leading with the cost savings, the first priority, facility efficiency, real estate optimization, saving utility and operational dollars off the bottom line that can be reinvested into patient care. Financing options, Jenny went through a few of those, federal, state, local, bridge loans, tax credits, utility incentives, anything and everything that can come bring capital to an organization like yours to be able to pursue some of the projects we'll talk about. Technical assistance, identifying those projects, interventions, built environment upgrades, clean energy design, facility resiliency, the ways that we can really scope it out to make sure these are shovel-ready projects and efforts. Data management with not only the baseline utility data calculating EUIs, but also future support for data management. Programmatic alignment was amazing within the cohort structure. Really, immense value with America's Central Hospitals, Healthcare Without Harm Practice, Green Health, and their programmatic efforts, calls and knowledge sharing and toolkits and case studies that support all of these deliverables and leadership buy-in. You can't undersell, facility leadership and really it's difficult for leaders to navigate some complex efforts like this that often with us at Oakwell, we try to formulate a model where it would oftentimes take two or three firms to deliver for some of this stuff. And bringing it together and really providing a linear effort to achieve those cost savings and providing like a roadmap approach for capital allocation to make sure those high level priorities are set and pursued. Community engagement, amazing things that happen through the Han programmatic efforts, including community members and project selection, and ideally working with local or minority business-owned organizations for project implementation, sourcing, and such too. And then even just real quick, building the cohort, we evaluated facilities. Are they an American Central Hospital Practice Green Health member? Scale of readiness, you need leadership support zone to operationalize. And then engagement with the facility lead, indicating interest, setting up intro calls, data collection to make sure these are viable opportunities, and then kickoff calls and really on the boots with our engineering team walkthroughs, interviews with facility staff, leadership, making sure those priorities are aligned. Skipping from the start all the way to results, like the end here. Amazing the work we got to collaborate with Grady Health and Grady Memorial and some of the things that you're kind of seeing here at the highest level. Some local context, with Grady, like the city of Atlanta has a goal to reduce greenhouse gas emissions 59% by 2030. Building performance BPS standards, which you see in New York City, Local Law 97, or Boston as BERDO. Seattle has some, and a number of other cities are bringing them on the books for really emissions performance standards for facilities might be active in the space in 26 or 27 and could come with meaningful fines. So a lot of demands on the grid in metro areas are continuing to grow. So if decarbonization might become less certain, there's an increasing need to right size energy use. So the things that we're looking, in the 25-year implementation plan roadmap, what we look to deliver for Grady was going to reduce electricity consumption by 10%. Doesn't sound that impactful until you see that we were actually moving to electrify a lot of the space. Reducing the whole energy costs, 23%, a massive reduction within emissions, 59% reduction in EUI, and then eliminating gas consumption. And from that highest level, what does that look like? We had it broken down here, like giving you full look into the projects and some of these efforts for the 25-year implementation plan, broken down into, 5 phases in a 25-year roadmap for an ability to have a view for strategic capital allocation through planned approaches, shovel-ready projects, making sure to prioritize and ensure continuous operations while ensuring the decarbonization works. And really, the roadmap here, it worked to deliver. I mean, the expectation is $41 million in associated energy cost savings. And through the incentives that were available right now, we were able to identify through a number of these projects over 12 million in identified incentives through some of those federal dollars that Jenny mentioned, some of the ones that still have the runway available, as well as utility incentives, some of the state related efforts. And what we did too was breaking it down into these phases really ensured that we could bucket the projects into efforts that could be prioritized. So like some equipment, any hospital you go, there's stuff that's at the end of their useful life. So what are end of useful life measures that have also savings and emissions reduction? Boiler plant efforts, EMS upgrades, new chillers and centrifuges, phase one, even into phase two. And then also a separate bucket of measures that are recommended, maybe not at the end of their useful life, but will achieve great efficiency and emissions reduction. Lighting upgrades, installations for PV, solar photovoltaics, new heat recovery chillers, envelope improvements, continuous commissioning. Hospitals are so incredibly complex in terms of their facilities, and there's always opportunities within the facilities. You'll see things like stretch, of course, continuous commissioning should, always be happening. There's dollars and cents to be saved here, with, of course, the benefits of, increased resiliency, better performance for your facility, better healthy and healing environments, more occupant comforts, patients, staff. Um, and then other measures, you see some of these things stretched out. You might see right now, like, hey, electrification stretched out a little bit far, but stuff like that, when you're looking at a really strategic effort, you don't take organizations like Level One Trauma Center in Grady that's been in existence for a very long time. I don't have how long, but older buildings that many of us reside in terms of flagship hospitals. Those measures are a part of ongoing building recommendations and potential future implementation. There's still opportunity for technology to improve with these. New builds to electrification are absolutely amazing. When you're able to achieve it and be able to scope it into the new facilities, but you're not just going to electrify a building right away. It depends on where you are. Strain on the grid is a real thing. But there's so many opportunities too in the existing infrastructure to really pursue energy conservation measures that save costs and don't skip the necessary steps towards, the sexiest technologies that are out there. Because there's tens of millions of dollars in savings in really any hospital that you walk in within the country. So giving you this view about how great it was, like collaborating with the cohort, collaborating with Grady, and really putting together an actual feasible decarbonization roadmap that's going to save costs, bring capital to the organization, and be able to collaborate, with an organization to pursue. So other high impact examples, we're finalizing the work with Henry Ford. Would love to, have their, roadmap and such, maybe in a webinar soon, and doing the same with Jackson South right now. But keeping it generalized, some of these implementations, high impact ECMs and project examples, delivering cost savings, and again, realistic, tangible plans to decarbonize. On-site solar, there's potential at one of these organizations like a 4.6 megawatt solar installation, thousands of panels on targeted areas to generate clean electricity. Geothermal heat pumps, you heard Jenny talk about. That's something to really take away that longer runway with IRA and federal dollars for geothermal. That's real. That's clean energy. There's a lot of opportunities there. Don't get scared off about doing evaluations and being looking at this. This is incredibly tangible, technology ready now. There's even some areas where gas infrastructure lends itself to geothermal. There's a lot of utilities that are actually looking to repurpose their gas infrastructure and look at geothermal and private projects. It's about these collaborations, about these partnerships, the things there. High efficiency boiler plants, there's often opportunities. I worked, I spent 10 years at Memorial Sloan Kettering Cancer Center, leading their sustainability department in New York City. There was always efforts to try to get off of some of the district steam. There's less efficient, there can be increasingly costly fuel sources that you don't want to be tied to. And there's a lot of kind of opportunities to shift away from. There's so much in the EMS controls, the smart controls, the optimization of the energy management systems with some of these ends. System energy efficiency for air exchanges to be at the minimum, but still aligned with regulations, resets, airflow setbacks, air handling units, pump resets, millions of dollars in potential savings there, and then upgrades to EMS. And try to keeping that at the forefront is always something to prioritize. And then just modernizing facility systems, projects, lighting upgrades, always low-hanging fruit, air handler unit replacements, demand controlled things, even for your kitchens and your hoods and things like that. Always kind of so much there. And bringing it back together, this work we're talking here, we're really honored and pleasured to be, with the impact purchasing folks and Han here. These are contributions to core sustainability goals, to Han's, past purchasing commitments, helping meet the healthcare climate pledge. I saw and ran through the attendee list as you guys were coming in. There's amazing leaders here that are committed to a lot of these, and we're all looking to do it in concert, as an industry together. And these types of efforts, though, you might say, like right here, I'm not the facility management person or the lead there, but this is facilitated by the trusted stakeholders at an organization that do this work, increasing on-site renewable energy. In a lot of these efforts, you get more dollars for the sourcing of local or domestic supplies, so strategic sourcing for infrastructure builds. This type of work is creation and support for local and clean energy jobs. And then, as we mentioned too, these successful foundational pillars, these are foundational efforts that sustainability and these types of programs are built on. High ROI energy efficiency has often been the foundation, or high ROI and transformative waste management efforts. And, really impactful now decarbonization and climate efforts, pursuing more climate, waste, food, purchasing related because we're saving costs, we're reducing impacts, we're decarbonizing and mitigating, we're enhancing operational inefficiencies in aligning stakeholders and decision makers, providing positive recognition and really marketing potential for brands that are out there. Your hospital and health system is a brand. It's, and that anchor of the local community. So was just really excited to take a high level look at some of these and appreciative of being able to serve the role that we do and collaborate with the cohort members and partner with Healthcare Without Harm, Practice Green Health America Central Hospitals. And that's it for my slides there. So hopefully stayed decently on time with that. And I will stop my screen share here. And yeah, thank you.
I saw that Suzanne had a great question about the reports being shared or expanding the cohort. I can like start and then I'll turn it over to you, Shane. I'm sure you'll have more information. I'll just share, Suzanne, that we don't have any immediate plans to expand, although of course we'd love to do more of this great work. But if you want to reach out to Jake, your SSM with Practice Green Health, we're happy to chat about if there are opportunities that make sense to leverage federal incentives or other opportunities that could make sense for Alina. And then I'll just also share that we did publish a short article kind of summarizing the findings. And so I'll add that to the chat. I think it'll also come as a post read for you all as well, but that might be a helpful reference.
Yeah, it's same. In lieu of immediate expansion of the cohort, we're having discussions on how this model can be scaled and applied, and we look forward to, possible future pursuits in this regard. And that same offers there, no obligation discussions on kind of what it looks like to deliver value for your organization. We're having those conversations constantly and kind of welcome those. So yeah, wish I could say, 10 new facilities starting in Q1 next year. But yeah, those are the things that we're constantly working in the background to work to deliver those and be able to collaborate with a number of your amazing organizations. But yeah, welcome any discussions with each of you offline.
Any other questions? I'll share. Often it's a bit difficult to understand how to get started, who to begin to have discussions with internally in your organizations, to say facilities or your value analysis teams. Do you have any suggestions for this group as to how to start the conversation, how to get started?
I mean, I could start with that. A lot of this, when you're talking about the cohort and maybe showing some of these things, the models, being able to plug in more to the healthcare without harm and practice, green health, that lends yourself to your sustainability folks. You yourselves, often hold up a mirror sometimes with the Han representatives, but some of this is rooted, of course, in the technical things in engineering space. So facilities and real estate leaders and socializing them with some of this and some of the successes that continue to come out are always really great stakeholders. And then any dotted line that you have to leadership and C-suite and folks that lead these departments and these high impact pursuits to get the value for your organization. Those are kind of the encouraging places to start and continue the conversation. I used to tell people too that the communication and being communicative about these types of things and asking questions it can yield so much. The worst possible thing that can happen if you ask a question in a collaborative fashion is, oh, someone says no or maybe not right now. And then you're right where you were 15 seconds ago before you asked that question. So not that much to lose in, being communicative, sharing resources. Some of those ends and stay at it because oftentimes it's about timing as well and being able to integrate some of this into your programmatic efforts year in and year out. There's a lot there, but being those change agents internally and being the facilitators is incredibly important.
Great point, Shane. Kaylee Swanson asked, can your team share the funding sources to help to meet safe harbor requirements?
Yeah, if it's helpful, I can share those slides again, or I think you'll all receive them too. It is a little complicated. Like I don't want to uh, basically, so there's the safe harbor requirements around like placed in service or beginning construction. They can be either or. And so often it's beginning construction, which means like you've outlaid 5% of the costs and begun the physical construction. But in some cases, there is this asterisk around like it has to be placed in service, meaning turned on. And then there are also some other nuances around if there are any other requirements around foreign entity rules applying, in which case it can be a little bit harder in some cases to use the credit. I don't want to, again, don't want to overly complicate it, but basically, so it's not a simple answer. That all I'll say, it's not a simple answer of like use these things by this date. Like we, for every organization, we do want to look into the specifics and what is applicable. But in general, the things that have shorter runways are like the energy efficiency deduction I mentioned and the vehicle charging. That's next summer. So it's a pretty short runway. And then for solar and wind, also pretty short, also next summer. But for other types of net zero energy like geothermal, there's a much longer runway. And then for geothermal heat pumps, there is no foreign entity requirement. And so that it's until 2033, which is already great. But then there's also not this onerous foreign entity requirement on top of it. So geothermal heat pumps, as Shane also highlighted, a great place to look into if it's something that could be applicable to your organization. And then also energy storage also has a long runway. And so I'd also think about no matter what your renewable energy is, if there is a way to store energy on site and have a microgrid, that has great benefits for your organization, likely because you'll be able to go off the grid if the power goes down. But also, there's an opportunity to get a lot of money back from the federal government for doing that for a long time. So that the two tables I'll share are from the NYU Tax Law Center that really go through the specifics. There's also an article that I think you'll all receive after this from that same tax law center that again like goes through a lot of specifics here. And I know it's very dense. So feel free to reach out to Practice Green Health or Oakwell to ask questions about these things. But I wanted to also clarify that it's not, always a simple binary. There are like a few other nuances as we think about whether or not your organization really wants to use this credit in particular.
And another thing kind of on that one, you know, don't lean everything into like the IRA. There were changes, but there's still a lot of money out there and there's a lot of potential, for hospitals and health systems. When the IRA first came around, one of the biggest things that we in the industry had as constraints was like, oh my gosh, there's all these pools of money, but hey, we're not aligned internally. We don't have the projects that are shovel ready. We don't know so a lot of things are happening out there, and does another version down the line of the IRA come? And you see the runway on some of these things. We're looking at 25-year plans. Do those types of things happen in the future? But when, federal pulls back a little bit, from federal pullback on some of those ends, the states pick up the slack. Like these folks are trying to get more efficiency within their local municipalities, and hospitals and health systems are very large resource consumers, as we know from these ends. So even if you don't have visibility to it right now, I can say from the deep dives that we've been doing on like the state level for some of this, the amount that they're starting to do on, hey, what are the public-private partnerships that can look to advance some of this clean energy work? What are some of the grants that maybe we can reinvigorate? What are some of the things that we can look at to pick up some of this slack? Because these states want this innovation. They want the jobs. They want the hospitals to be improved, from all of this end. So it's, some runways were reduced and things like that. There's still, there's still a while to get projects scoped out and having conversations on solar opportunities, that are happening right now. And can 5% of that project be moving by the early July next year, Jenny, for that date to be able to realize like there's a lot that can be done in that time frame, but having these conversations start to making the strategic efforts to have the readiness for your facilities to be able to do that, because what funding sources that exist right now don't look the same as funding sources in 2026, which is a few weeks away, which don't look the same as 27. And there's just, being able to start structure and being prepared and being strategic about it, because if some amazing funding comes, if you're ready to go, transformative efforts for your hospital or health system. Like just so those are the recommendations too, being proactive.
Good. It looks like Cecilia from Advocate Health says we're looking at geothermal in several projects and have been building out the business case for choosing this as an alternative source of heating and cooling. If others are also creating this business case, happy to compare notes. Key themes that come up as we move toward all electric include operational costs, resiliency, maintenance, reduced energy use, and the new tech learning curve. Also avoided costs for RECs or offsets if they have a carbon neutral target. Thanks for sharing that. Looks like oh, thanks, Jenny. You dropped something in the chat. Do we have any other questions?
I'll just add, I added in one thing, which is New Jersey has a one-stop shop for climate funding that I think if you're in New Jersey, it'd be great to look at that. Michigan has also stepped up with some accelerator funds that I know Shane's team has been in touch with them about. So I think to Shane's point, some states are stepping in. That's not, a uniform thing. And so I think it's great to think about where the federal incentives can fit into your key priorities. But I also think reaching out to your state's resilience officer or climate officer, if you have that, to talk about funding is another great step to think about as you start to scope what is feasible and where there might be opportunities from both the utility incentive side as well as hopefully state or federal incentives.
And you guys wield a lot of power telling those states that we want some dollars for these things, can go a long way too. So, have those in there for your government affairs folks.
And Cecilia said she also would also offer to share a process on how to navigate the IRA tax credit registration or submission process. Wonderful.
Awesome.
Any other questions? Okay. Well, if there aren't any other questions, I want to just share with you that our next optional office hours for 2025 will be on Monday, December 15th at 4. And the topic is envisioning your 2026 strategic goals for the year ahead. And that'll be hosted by Sarah and myself. So we're looking forward to working with you on your goals for 2026. And you will be receiving calendar holds from T. They will be sending them out shortly, so look for those. And again, the information that we share together is powerful, helpful for our organizations. If there's someone that should be in these calls and they're not here, let T know, and T will add them to the calendar. And I think with that, if you have any more questions, feel free to reach out to me. There is my contact information. You can also reach out and set up time with me and the team using our Calendly link, and you'll receive that as well. And with that, there are no other questions. We're going to give you a few minutes of your day back to yourself. Thank you so much, everyone, for joining the call.
Thank you.
Great.
Thank
Thanks,
you.
Sylvia.
All.
All right. Bye, everybody.
Hi, Sylvia. I'm sorry I joined late, but is there a link in the chat with the Calendly for you?